Susie with Broadway Skin Essentials at Broadway Plastic Surgery. And this is Allison, and we're here to do a vaginal rejuvenation treatment today called Viveve. Allison, tell me a little bit about yourself and what brings you in.
Hi, I'm Allison. I am almost 49 years old. I have 2 children, and I'm excited to experience this alternative to surgery called Viveve. I have been having symptoms since childbirth of a little bit of urinary incontinence, and also vaginal laxity is an issue after childbirth. I'm sure as many women experience. I'm excited to see what Viveve has in store to help these symptoms. The other things that Viveve promotes to fix and help women out with is sexual sensitivity. It helps with vaginal moistness and helps with that rejuvenating some pieces of lubrication during sex, and helps a lot of times women experience dryness after they go through pieces of menopause and childbirth and different things that women experience in their life. The alternative has been surgery, and I'm excited that this is an alternative.
Great, I think you're a great candidate for this treatment.
I'm excited, Susie.
Well, let's get started. So Allison, this is our Viveve machine, and this is going to be the handpiece with this 8-centimeter tip attached to it. This is what's inserted directly into the vaginal opening. About the deepest we go is 5 centimeters, so not very far at all. We split the vaginal opening up into quadrants, and we do 25 pulses in each area. The first round is going to be 100 pulses, and that treats the sexual function. So helps stimulating the nerve endings, helps with lubrication, and can help you have better orgasms. The second 100 pulses is for the urinary incontinence. So when you're out working out or jumping up and down, laughing, no more leaking.
Amazing.
Also, what's great about the Viveve is there's cryogen. So as this is heating the underlying tissue, it's cooling simultaneously.
So no injury or burns or?
No, not like any other laser out there. This is the only one that has the cooling that has no risk of a burn.
That's great. That's why I chose Viveve.
As seen in our animal treatment model, just enough heat is delivered from the treatment tip to the underlying tissue to subtly change the collagen while a coolant protects the surface. Over the 7 to 10 days following the procedure, the treated tissue remains essentially the same. However, within approximately 30 days, cells within the tissue activate and initial replacement of the subtly altered collagen occurs. This restorative process continues from approximately day 30 to at least day 90. Over this time period, additional cells within the tissue activate and new collagen formation continues. The restored tissue shows increased collagen content without any damage to the tissue.
So before the treatment, you did empty your bladder, correct?
Yes, I did.
Perfect. Do you have any questions before we get started?
I don't.
Okay. And then we'll get started, okay?
Okay.
We're going to go ahead and start. This will be just the tip. Now the first few pulses you might feel a little bit of heat. If it becomes uncomfortable, let me know and I can always add more coupling fluid, okay?
All right.
So, 1, 2, 2. Is that feeling okay?
It feels fine. It doesn't feel like anything really.
Perfect. And that sound you're hearing is the cryogen cooling. So comfortable?
Yeah.
Great.
That was just a leg twitch. I didn't feel anything. I'm so surprised as sensitive as the area is, you don't feel anything.
Some women may feel a little bit of heat, but everyone's tolerance is different, but no one's uncomfortable.
Yeah, you can tell that there is a temperature change, but it's not painful in the least. It's amazing to think that you only need one procedure.
Yes. So women start to see the results about a month after. Your end result is going to be 90 days after.
What kind of downtime is there?
It's really not downtime.
Do you recommend not having intercourse for a certain amount of time afterwards?
Yes, so for up to 48 hours after, you want to try and avoid any intercourse or penetration, anything like that. You might notice some slight swelling or redness. It's completely normal. And you might notice that your urine is a little bit warmer than normal.
Okay. So what exactly is this stimulating inside?
So just like on our face, as we get older, we start to lose collagen and collagen starts to break down. Same with the vaginal lining. So this is just stimulating that production and help plump everything back up.
Wow.
You still doing okay?
Still feels like nothing.
Great.
How does this differ from other lasers?
This is the only one that has the cryogen cooling unit. Others are just the heat, so you're subject to a burn, unfortunately. But this one's completely safe.
That's great. I've heard some negative things about some other procedures. That's why I chose to go with Viveve, because it doesn't have any of those side effects.
Yes, it is the safest on the market.
Great.
Still feeling okay?
Susie, why isn't this done, say, in an OR or a sterile environment? Does it need that?
So it doesn't need to be a sterile procedure. It's a very non-invasive procedure, and everything is clean and sanitary, and it's cheaper not to be in the OR.
So clinical setting's just fine.
Yep.
Great.
And more comfortable.
Great. But it keeps the cost down too.
Yes. You still feeling okay? Not too warm?
Susie, how did you learn how to do this? How are you trained?
So I'm a medical esthetician and I'm laser certified. And then the Viveve themselves had a trainer to come out and show me how to do the procedure and certify me with the Viveve.
Great. So they traveled to you.
Yes. Okay, so now that we're done, again, post-operative care, you want to avoid any penetration or intercourse for the next 2 days.
Okay.
And again, your urine might feel a little bit warmer than normal.
Okay.
And I'll check back in with you in a month or so to see how you're feeling and if you can start to see the results.
Okay. And why did you say that it was my urine may be warmer?
Because we're internally heating the tissue right around.
Oh, so it's
there.
Okay, makes sense. All right. Well, there was no pain associated with it whatsoever. I was comfortable throughout the whole procedure, and thank you very much.
Well, thank you. I'm excited for your results.
I am too.